Welcome, friends, to another episode of the Movement is Medicine show, brought to you today from right here at Head to Toe Spine and Sport Therapy in Edmonds, Washington, where we make healing happen. Now, let's get into the show. Welcome, everybody. How's it going?
What's up, Bear?
What's up, Barry?
Awesome, guys. Well, happy day. Today we are talking about the shoulder.
Yeah. Love it.
Yes,
a lot of
we
fun
are.
stuff with the shoulder.
Yeah, and the shoulder is one of these weak, I mean, it's perceived as kind of like a weak joint or maybe a complicated joint that is susceptible to injury. Is that true or false?
I'd say so, but it's kind of just like the hip. The hip and the shoulder, those being the most mobile joints in the body, they tend to have, you notice things when they stop working as well as they can.
Okay, so it's not that it's weak or it's poorly designed. You know, we're not throwing down, saying evolution or the big guy in the sky messed up with the shoulder. We're just simply saying there's a lot going on. There's a lot going on at the shoulder.
Yeah, there's a lot of fail points, I guess you could say.
Mm-hmm. Yeah. When we think about, like, if somebody were typing in, shoulder pain or shoulder injury, what's some of the most common ones that we see?
Ooh, I feel like one of the big ones that pops into my mind is a lot of people throw around the term impingement a lot. Mm-hmm. And that's definitely a big term that gets thrown around. People come in all the time and they're like, yeah, my shoulder is impinged, or I have impingement in my shoulder. Mm-hmm. And a lot of times when you kind of take a dive deeper into that, you might find a lot of other things going on along with that that's actually causing that shoulder pain. Now, I'm not going to say that there's never going to be any shoulder impingement, but that's definitely a big one that I feel like people search, one that gets thrown around a lot where it's like, yeah, I have impingement in my shoulder. And it's like, well, there could be something else going on there.
Right. And when they say impingement, what do they mean? They mean like they have a mobility issue, basically.
Potentially a mobility issue, and a lot of times it's for people, we work with a lot of CrossFit people, but it doesn't even have to be that. People that work out, or just when you're reaching up to do something in your house, like grabbing something out of a high cupboard or something like that. You get pain when you're reaching up, lifting that arm up, you're going to get some pain when you do that. It can be a sharp pain, can be a dull pain on the outside of the shoulder, back of the shoulder, front of the shoulder. But a lot of times, especially with that outside of the shoulder, people immediately want to jump to, it's like, oh, I have shoulder impingement. And it's just like, and that's such a broad term to begin with anyway. And it's just like, there's usually more going on than that.
I think you bring up a really good point too, which is like what's kind of happening or with that shoulder and that shoulder issue. Yes. So are you in the gym and you're trying to pull off some kind of lift, or you're looking to kind of push through a strength or a mobility issue that's related to that shoulder? Or are we talking, like you said, no, it's around gardening, or I get lifting up something off of a shelf, or reaching overhead, or I'm trying to get something in the garage and I realized, I'm having a really hard time. Because I think those oftentimes are different scenarios that we have going on. And I think about, too, the difference of a 25-year-old who's push pressing a bunch of weight or doing some snatch and, goes too heavy or too far and does something in their shoulder, versus like a 73-year-old who, maybe they haven't even been like using that shoulder actively in like in a strength training scenario. And what we actually have is maybe a lack of use it or lose it type of thing that's created. So can kind of depend on what's going on in your life.
Yeah, no, 100% can depend on what's going on in your life. Your age definitely, factors into it too. Your activity level factors into it as well, where it's like, no, you're exactly right. Probably the 22-year-old that's push pressing like some weight in the gym and he's feeling some pain on the outside of his shoulder and the shoulder in general. That's likely, now not all the time, but likely going to be a different issue than like, a 73-year-old woman who's like trying to lift something up into a cupboard or doing some gardening, reaching over her head. It's definitely different types of things that are going on there for sure. Yeah.
So we have basically okay, what's going on with your shoulder? And a little bit is that stepping back and looking at who are you, where are you feeling the pain, or lack of mobility, or what the issue is, right? And then we would say also, there's also people I think too who have chronic shoulder issues, and they're looking to try and find a solution to that. And I'm thinking here like rotator cuff tears, like some of these types of things.
For sure. Definitely. Like those are likely the things that people would liken to an impingement. Is usually like a strain of the rotator cuff, or like a tendonitis in the front of the shoulder. With those things, they're just pain. They cause their inflammation processes, and they can alter the way people function in general.
How common would we say shoulder issues are?
Oh,
I'd say
we do see
super
a
common.
decent amount of that.
Oh, yeah.
It really depends on how you want to, in my opinion, you want to classify the shoulder, because like if you could have a low back issue and it's causing some shoulder issues, like in general, we'll see people, if you've got low back pain over a chronic period of time, if you've got some sort of compensation towards that, like say you bend a little bit towards one side, that usually indicates a shortened lat, which is always going to throw off the way that your shoulder actually works. And with these, I mean, I'm working with a patient right now who she has an extremely shortened lat. She injured her rotator cuff, I believe, a couple months ago. She didn't say that specifically to me, but based on what she described, that caused her to not move for months just because of the pain. And now she comes in with a frozen shoulder. So we've talked about this in the past with the frozen shoulder in the sense that there's a freezing, frozen, and then thawing stage, whereas she came in with essentially a frozen shoulder, like it wasn't going past overhead. And what we've kind of whittled it down to is the shortening of some musculature that's compensating towards all those stresses and the lack of motion. And those are just things that we have to unwind over time.
It's like so many times that we've talked about in other situations and other issues in the past, there are times where you have an injury or a problem that is manifested directly in that area, right? So it is a specific shoulder thing. But here what you're describing is actually a lat injury, which then over time leads into a shoulder issue. Right. And that's probably more typical almost of what we see, right? Is this kind of cross-pollination of situations, like a kind of entanglement of stuff, which is why it can be difficult when you're trying to self-diagnose and self-care at home. Maybe you're hitting it with a lacrosse ball, or you're trying to foam roll, and it's just, or you're trying to stretch, and nothing's really happening.
Right. I mean, some of these injuries with the shoulder, like a tendonitis or like maybe a contusion, like they're pretty cut and dry. Like you've got one area that's painful, you release the tension around the area, or you get rid of the inflammation over there and the pain goes away. But when we're talking about like what you just mentioned, like something that's more of like a functional track or train type of movement where like it's more predicated on the fact that the lats connect with like a bunch of other different muscles. It gets really complicated from that standpoint, but at the same time, we're pretty good at unpacking that stuff. That's why we like to do biomechanics here. We're very holistic in general. We're not going to look at your shoulder and go like, oh, this is just specifically a shoulder issue. And that's what I think puts us above the rest.
Yeah. And I definitely feel like that's, I feel like, all of us here, we get a comment from our patients a lot where it's just like, wow, like I didn't really realize like how much things were connected. Like, you didn't really realize like what could be causing what. And I think that's definitely, you really need to look at the body as a whole, like Dr. Lee just said, like taking a look at the biomechanics, look at how you're functioning, look at how you're moving, and really kind of like reduce down, okay, like why did this happen? Because like, you might know where you have pain, like, you know where you're feeling it, but like, we want to figure out why that happened, where it's like, in some instances, like even you mentioned, Barry, it's like you might have an injury, right? Yeah, you injured something in your shoulder. You're going to feel shoulder pain. But sometimes when that pain comes over gradually over time, we have to really find out, okay, why did that happen? Like what biomechanically, what patterns, like what posture really kind of added to that pain, like led to that pain. So it really becomes multifactorial at that point.
This is where we put on our detective hat a little bit and try and peel back the onion. Figure out what's really going on.
Yes.
Peel back the onion in the shoulder. It's true. There's layers. Plenty of layers.
And Ash, I'd love to hear your thought on this, but I mean, in your experience, have you seen people sometimes gravitate towards maybe what they think is the need for a surgical intervention or a type of thing where they're looking at, they think there's something maybe totally torn or broken when actually in actuality there is a musculoskeletal component that they need to address first?
I mean, there definitely is some worry from some patients in regards to that, like seeking, other alternative therapies or, higher imaging or whatever it is. But I think the biggest thing there is the communication. A lot of the patients that we see, or at least I've seen, have come from other providers before and, don't get the answers that they're looking for, or they're not given the right information. And so they're getting all these different sides of the story without kind of pinpointing what the actual problem is. And I think that communication aspect and actually getting down to the bottom of what's actually going on, like what Dr. Tim was touching on earlier, is going to be huge in either going down that surgical avenue or not. And it'll definitely shorten up the treatment plan even too, and that's always good.
Right. So what you're saying is step one, let's figure out what's going on.
100%.
Then step two is let's put them through kind of our treatment protocol, our track. So let's break that down a little bit. We essentially usually have kind of a three-phased approach, or kind of three kind of angles that we like to go on this. So let's kind of get into what that would look like for a shoulder situation. So we diagnose, figure out what's happening. Then what are we going to do next?
The biggest thing that we want to do is we want to set the environment for healing to occur. So with any injury, there's going to be guarding around the area. There's going to be muscles that are tightening, splinting, spasm, just to try to mitigate the chance that you're going to re-injure the area or injure it further. So the biggest thing that we have to do, step one, is releasing all that tension, providing the environment so that if there is swelling that's accumulating, that it can actually escape the area, which is oftentimes like what we see here, like when people are fresh in an injury, is they're so swollen that everything hurts. But if that swelling should be escaping for some reason, and for some reason it's not, whether that is a motion issue, because we know that motion will squeeze those muscles, it'll squeeze some of that swelling out of the area, or whether that's an actual muscle buildup or scar tissue buildup component where we have to go in and physically remove that extra tissue that's kind of causing a traffic jam, for lack of better terms. So in that, providing the environment to allow things to heal is definitely going to be the first and most important thing. And we can do that with many different things, but mostly it's going to be done with soft tissue work in this office.
Mm-hmm. Yeah, definitely soft tissue work. And we have multiple different techniques that we use for soft tissue work, especially for the shoulder itself. I know that, obviously getting in there with our hands, kind of releasing, getting that inflammation out of there, kind of pushing that excess fluid out of there. Also using instrument-assisted soft tissue for certain tendinopathy type issues or anything like that. Rotator cuff issues can work really well for that. And even cupping therapy, really great at just kind of getting some more blood flow into the area, getting some release on those muscles. Like Dr. Lee was saying, we really just want to get that excess fluid out of there, get that excess inflammation out of there. And then really from there, really as early on as possible is trying to get the joint, trying to get the muscles moving, right? Mm-hmm. Where it's one of our big things here, movement is medicine, right? We want to get those joints, those muscles moving to continue to push that out and try to restore proper range of motion, like full range of motion, after we can get pain-free range of motion by releasing the muscles. Mm-hmm. So, and that's kind of that, kind of getting into that initial phase. Let's get you out of pain, get the muscles functioning better, get some range of motion out of that. And then we can kind of go on to next phases from there.
Which is what?
Chiropractic manipulation. We are chiropractors by trade. But, obviously we have a lot of other therapies that we do. Movement is one of them. Soft tissue is another. And a lot of folks are surprised that we do all three. And there doesn't have to be a separation between, you guys are my chiropractor, and then I'm going to go to my massage therapist, and then I'm going to go see my PT. No, we do it all, and it's a one-stop shop for everybody.
And that's where kind of then we move into corrective exercises and some of the stuff that people can work on at home.
Right. I mean, you have to build that strength component, or you're not going to actually drive change in the nervous system. So what we know for sure in this office is that once we get the inflammation removed, we've restored motion back. In order to maintain that and to keep those two things, we have to strengthen the area. We have to drive change in the form of building up muscle or proprioception or balance or whatever that is for that specific case. But we know that we're not going to be able to do that unless we add some resistance of some sort. So resisted exercises, corrective exercises, movement in general. If you don't use it, you lose it. It's the worst cliche there is, but it's actually true. And I hate to tell people that. I laugh every time I tell them. But if you're not moving something repetitively and after a couple years it's gone, don't be too surprised by that.
Yeah. Mm-hmm. And definitely with that going into the rehab, getting things moving again, it's one of the things I feel like we do a very good job of here, as a team, is teaching people how to move correctly. Teaching them how to move in good ways, especially if we're talking about the shoulder here. Healthy ways to move the shoulder to make sure that we're keeping those muscles active. Mm-hmm. And just another addition on top of that, as we're getting into the strengthening phase, strengthening up those muscles again, making the shoulder more resilient again, you can probably expect there to be some core work in there too, which is something that, some people don't think about core related to shoulder, related to extremity, hip, knee, that kind of stuff, but it all ties into it. If we don't have that stable base, in our midline, and we're talking deep core and everything too, if we don't have that stable base to derive that strength from, then we're not going to gain as much benefit as we could if we're just going to focus on one aspect of the body, if we just focus on the shoulder. Right. So tying that into it really kind of rounds out that rehab care that we do and really helps those changes, those biomechanical changes that we make really set in even better.
100%.
Yep.
I think when you're a person who's experiencing a shoulder issue, and depending on how severe it is, it can feel overwhelming. It can feel like a complex. You might have seen a half dozen specialists and still don't have an answer. And really the message we have for you is almost always there's hope for you. There's a healing path forward. Oftentimes it's what sounds complicated and looks complicated. This is where we like to dig in there and try to figure out and understand what's really going on, and how do all of these different pieces, the biomechanics and the physiology and the joint structure and all this stuff, how and the inflammation and what's going on from your body's response to some kind of an injury or an issue. We try to figure out how all that is interplaying together, and then we systematically deconstruct it, start bringing that relief in, as Lee said, creating that healing environment, and then building a plan to restore function and restore strength over time. So our message is really, there's hope. If you have a shoulder issue, even if it's complex, we want to get in there and we want to figure it out. And that's the thing. I feel like sometimes people, they lose hope, or they go right to a surgery option, which can be sometimes the right call, and sometimes it's a premature call. So it's like, definitely there is options available, and get a second opinion and realize, like, you don't have to be stuck with it. You don't have to live with these conditions. You can get help.
Yeah. 100%.
You can.
Awesome. Well, if that's you, if this resonates, know that we're here to help. And, if maybe it's just your family or friends. I still know I've been working on my wife's mom's husband. So whatever he is to me, I call him my dad, we joke, but I've been working on him to get in here for so long. And he's like stuck in his ways, an old grouchy hermit, won't get off. It's like, dude, you don't have to live with this. Like, you can move your arm over your head again.
Yeah.
So, Brian, if you're listening to this, I'm calling you out right now.
I'll see you in here.
Awesome, guys. Well, hey, thanks for joining me on today's episode, and we will look forward to seeing you next show. We're going to dive into some more body parts. As you know, we like to figure out ways to get people moving again and get them back to doing the things they love doing. Until the next show, stay strong, keep moving, and we'll see you soon. Thanks, everybody.
Thank you.
Thank you.